Hi, I'm Dr. Sheila Reyes from the Philippines, reporting virtually for Room Now at the ACR 2023. In clinical practice, we get patients with chronic back pain who have imaging features suggestive of inflammation or degenerative changes. But what if these findings overlap in a single patient? How do we approach the diagnosis? That being said, I wanted to highlight abstract number 1862, which described overlapping spinal imaging features among patients with a diagnosis of degenerative changes of the spine, DISH or diffuse idiopathic skeletal hyperostosis, and radiographic axSpA. The study was a cross sectional analysis of a real life cohort of patients referred to a tertiary rheumatology center who presented with chronic low back pain. Their cohort were mostly males with a mean age of 63.2 years, a relatively older group who had been diagnosed with either degenerative changes of the spine, DISH, or axSpA. When the study investigators compared the thoracic and lumbar spine x rays and MRIs of the three spinal diagnosis groups, they found a significant overlap of inflammatory and degenerative features. For the results, as expected, inflammatory lesions on conventional radiographs of the thoracic and the lumbar spines were more prevalent in the axSpA group, but it was also seen in both DISH and spinal degeneration groups. Similarly, bone marrow edema was also seen in the thoracic and lumbar spine MRIs of the patients with degenerative changes and DISH. Well, what could be the explanation for these overlaps? There was really no mention of it in the study, but may be worth exploring in future investigations. What's the take home message we can get from this? Knowing that inflammatory and degenerative overlaps can exist in these three conditions, as defined by the study, we should always correlate clinical and imaging findings and consider mimickers of disease, especially if patients would present differently or would not respond to conventional treatment. Since the thoracic and lumbar spines were the only areas imaged in this study, and of course, it was probably because this was the only focus of the study, logic would dictate that in clinical practice, if we were considering alternative diagnosis, imaging of additional areas such as the cervical spine or the SIJ or requesting for blood tests would make for a more conclusive diagnosis. But of course, that's a different discussion altogether. And given these results, well, we could wait for further investigations in the future that could help us make a more conclusive um, finding regarding these overlaps. Follow me at Rumarapa and tune into Room Now for more reports and videos of the ACR Convergence 2023. Thank you.